Okay. So let's start here on the head.
Okay.
So we did just briefly go over the cerebral circulation and the fact that, this is going to be on the model. And there's essentially three main vessels to think about.
The carotid, the superior, and then inferior, right?
No. So what we're talking about is three main arteries that come into this circle right here. So internal carotid, you're correct, on each side, right and left internal carotid, and then the basilar artery.
Okay.
See how it runs in there?
Yeah.
Yeah. And then you've got this major artery that comes off here, which would be what? It's kind of in the middle.
I'm not.
That's middle cerebral. So three main arteries that come off.
It got all blurry. I couldn't see it.
Oh, okay. Three main arteries that come off the circle of, three pairs of arteries that come off the circle of Willis. So you got the anterior cerebral.
Okay.
And the middle cerebral and posterior cerebral.
Got it.
So let's see.
So it's carotid, cerebral, and mesenteric, you said? Or not mesenteric, basilar?
Those are the three that supply the circle of Willis, yeah. And then the three cerebral arteries are anterior, middle, and posterior. So the posterior is the first one that comes off. Right, let's see. Comes off right here. So it comes off, and if you follow it, it'll be, well, yeah, I think they show that. Really runs to the posterior lobe. So anterior, middle, posterior, and then basilar, and then these two arteries here are what? That form the basilar. Those are vertebral. Okay.
Okay, got it.
Yeah. So they're this artery that comes off here, and you see where that comes off? The subclavian. Yes. So the vertebrals come off the subclavian and run
the vertebral artery. Okay, got it.
Yep. And I think just the sense I got, that's probably as deep as they're going to get on the intracranial arteries, probably the circle of Willis. You do have this, this one right here, the anterior communicating, which is right in between those two, the two anterior. And then these back here are the posterior communicating.
Okay.
All right. Okay. So let's see. What else did we go over? Well, we marked a lot of stuff. And so let me go to right here. Let's blow that up. Not quite that much. Okay. So name these three arteries for me, coming right off the aorta.
We've got subclavian. We've got common carotid.
Which side?
The right's the left, the left's the right.
Yeah. So where were you starting? Right or left?
We start from left to right. It's
okay.
Right subclavian, and then it's common carotid, and then it's left subclavian.
Yeah. So, but this one, there's only three, right? So this can't be the subclavian alone. If this is subclavian carotid, what's this? You got carotid here, you got subclavian here. What's this?
Oh, the brachiocephalic trunk.
There you go. Yep. Yep. You don't want to mislabel that.
Okay.
Common question. So the other thing we looked at on the back of the ribs, on the back of the chest wall, where it opened, we had it opened up, was an artery that was stuck to the inside of the chest wall. It comes off right here. You remember what that one is?
I don't.
Internal thoracic.
Okay.
All right.
And then the one on the other side was the jugular that goes up, right? The vein.
That's a vein.
Okay.
So we'll get to that in a minute.
Okay.
But this is the vertebral. The first one that comes off.
Got it. Okay.
This is a vertebral that we looked at in the lateral view over there.
Yes.
All right. And I think that's all you need to know there.
Okay.
Then the abdomen. What's this here? The three arteries coming off of it.
There's
just what the
superior
main
mesenteric
artery is. Nope.
Oh,
nope.
The aorta, abdominal aorta?
Well, this whole thing is abdominal aorta, but this one here, it's got three major arteries that you need to know that come off, but the trunk has a specific name. Celiac trunk.
Okay.
Remember that?
Yes.
And then this is the superior mesenteric right here. So those two will be right together,
okay.
Always. They're big. And can you name the three arteries that come off of there?
Is it like is one of them the splenic, or is it not? Okay.
Yep. And
okay.
It's the one that will run in the direction of the spleen, which is the one taken off to the right there, or to the person's left.
And then the renal arteries aren't a part of that one, right?
Nope. Nope. These all go to upper abdominal structures. So liver, stomach, and spleen.
So then it'd be gastro.
So you have the left gastric, and then the common hepatic that come off.
Okay. So
let me go
gastric,
over here and we can see this a little better. So this one is the splenic.
Okay. That's the one that's kind of like coily, right?
That's right. Kind of like a little pigtail, and it runs along the edge of the pancreas.
Got it.
And then they're showing this left gastric a little different here, but let's see, maybe this will show that better. The left gastric is one of the three main arteries that comes off. So it is on the left side, and then the one that comes off running to the right is the hepatic, and the first artery that comes off of that, or actually in this case it's the second artery actually, but is the right gastric. So it just makes that loop, you know, if you remember our thing here. So left gastric, right gastric, and they just kind of loop together around the inside of the stomach.
Okay.
And then the common.
And then where does the right gastric go?
Well, the right gastric, let's say it loops back and runs at anastomosis with the left gastric. So it just makes a loop.
Got
In
it.
the inner curvature of the stomach. Here, this will show it better. So there it is there. This is left gastric.
Okay.
And right gastric. Right gastric comes off the common hepatic. And then then after that artery, the artery going to the liver is called the proper hepatic. Remember that?
Okay.
Let's see here. Yeah, and then it'd be hard to see the hepatic arteries, but they're the two that come off of that. They're the last ones to come off. So they'd be those two running into the liver, but they're kind of buried down in the liver. So you got proper hepatic and common hepatic, right gastric, left gastric, splenic. So just think of that three-way prong, and remember the names of each of those coming off, and then just remember that the right hepatic comes off right gastric comes off the hepatic.
Okay, cool.
Okay.
That makes sense.
Yep. Then you've got the superior mesenteric, right?
Right. Okay.
And where does it go? What's it supplying?
The intestines, right?
Yeah, small bowel and the right side of the large intestine, or the colon, right colon and small intestine.
Okay.
All right. And then what's this?
The common iliac?
No, right here. Here's the aorta. What's coming off there down low?
Oh, the inferior mesenteric?
Yep, that's right. And so it supplies the left colon. So the entire small intestine is supplied by the superior and the right colon. In the inferior mesenteric just supplies the left colon.
Okay.
All right. Okay, let's see here. All right. So let's look at the arm. Let me blow this up.
Okay.
Okay, so you're looking at the subclavian.
Yes.
Correct. And what's that artery called when it gets here?
Axillary?
axillary, that's right. And in actuality, and I don't know that I made this clear enough, but it's actually, from what I can see, considered, let's see, I think I need to let people in here. I don't know. I guess they'll speak up. Well, no, if I don't let them in, they can't. Hang on just a minute. Lexi, I'm going to stop sharing and see if, no, we're the only two still on. Okay. So hang on, I want to check something here on this. Yeah, so the brachial artery, I was trying to tell where it changes from axillary to brachial. We're not going to get that picky to trip you all up, but somebody will do that. So it's I think it's after these circumflex arteries, but I wouldn't worry about that right now. It'll be marked pretty clearly. So as you know, this is the brachial artery that comes down here. And then what's it split into?
Oh, the radial ulnar.
There you go. That's good. Yep. There were a couple of the cadavers that you could see this deep brachial, and so the arm and the leg are kind of the same to some extent. So you got femoral, which is kind of the same as the brachial in the leg, and so you've got a deep femoral and a deep brachial, and they come off right around the same spot, just under the head of the humerus or the femur. And so if somebody pins something that's kind of diving down deep, that's going to be one of those deep brachial in the leg, deep femoral arteries.
Okay.
And then and I can't imagine you getting hit with either of these, but these are both collateral arteries. And because this one's on the radial side, it's radial collateral. And then on the left, it's the, no, it's actually called the superior ulnar collateral.
Okay, that makes sense.
Yeah, yeah. And then anything in between here is going to be interosseous. So you got common, posterior, and anterior. I would just remember common is probably all you need to remember. Anything down here, I wouldn't worry about. Just remember that any artery that they tag, just above the hand is, if it's on the thumb side, it's going to be radial. If it's on the non-thumb side, what we call anti-thenar side, it's going to be the ulnar.
Okay.
And then you can use that same trick in the foot or the leg. If they're going to stick anything in an artery in the leg, if it's behind the lateral malleolus, the big bone that sticks out on your ankle.
Yeah.
That's going to be posterior tibial, right? It's posterior. It's in the back of the foot. And then if it's something on the top of the foot, that's going to be dorsal, your dorsal artery.
Right.
Okay.
Okay. And then is it pretty much going to be the same for veins, like mainly just the bigger stuff for the quiz?
Yeah, I think so.
Okay.
Let's go back and go over that.
Will there be a lot of like the lymphatic system on the quiz as well, or is it mainly just veins and arteries?
Well, there will be lymphatic and respiratory. So
Okay.
we'll go over some of that here in a minute too.
Okay.
Let me check and see if anybody else has joined us here. It looks like just the two of us. Yeah. Okay, so veins. Remember, veins have valves in them.
Yes.
Sorry, I got lost here. There we go. Okay. So in the chest, the veins are not very exciting. You got the superior vena cava, and then right and left subclavian, or sorry, right and left brachial.
Okay.
Let's see. Is that what those called? Let me back up and just make sure. I'm sorry, brachiocephalic veins, because they're like the right the brachiocephalic artery. They send off jugular vein and subclavian vein. Okay.
Okay.
So right after they come off the superior vena cava.
Okay.
It's those two right there. So they're returning from the head and both arms.
Got it.
The other thing that we found there, and I think you got to see this early on, is this jugular vein. I'm sorry, not jugular, azygos vein.
Yes.
The big
we saw that in one of the cadavers, right? Yeah.
And then the other thing that we found, speaking of the lymphatic system, the other night was the thoracic duct. And so let me just jump over here and show you where that's at. Yeah, here we go. So it is, let me blow this up a little bit. I'm a victim of my own creation here. I have a big Linux server with 3 giant monitors. I've got stuff scattered all over the place here. Okay. So right here, running into the subclavian vein on the left is a thoracic duct.
Okay.
All right. I doubt if that'll be marked, but just in case, give you a heads up there.
Okay, sounds good.
All right. Okay, so that's the chest, and the inferior vena cava we really address in the stomach and everything. From there, you can. I don't think we can identify them, but you've got the. This is azygos running all the way down. This is hemiazygos, and this one up here is the accessory hemiazygos.
Okay.
Okay. All right. Now the veins in the abdomen are a little different. So one thing I should have mentioned when we back here on the arteries to point out. So you'll notice that you've got these two long arteries coming off here. Those are what?
The renal, right?
Well, renal up here, but these are running down into the pelvis. So what's in the pelvis? Gonadal arteries.
Oh, gonadal, yeah.
Yeah. And then when we look at the veins, they're a little different. So you've got the gonadal vein comes off the left renal vein. Right.
Okay.
And the right gonadal artery comes off the inferior vena cava.
Okay.
That's a little switch up on there. So, okay, so these three veins up here, where the liver usually are what?
Are they kind of the same as the arteries?
They're not actually, and so that's what we want to point out. The venous system, if you remember, everything that runs from the vasculature. Well, let me back up for a second. You've got the liver sits right over this. So these are where the hepatic veins pour into the into this inferior vena cava. And I guess it's probably best to just go through here and work backwards. These both roll into this larger venous system. Okay, so they come together. Let's see here. They come into the hepatic portal, which is right up here. So they're collecting everything from the small bowel, as well as actually the stomach, spleen, and running it through the liver. So you've got this giant filter system, right? The liver, right. And the hepatic portal vein is the last one that just kind of disappears right into the liver. But everything running into it are either the superior mesenteric or the inferior mesenteric, where it actually runs into the splenic vein. Okay. I was trying to find a better drawing that showed that. But I don't have one. But anyway, you can actually see it runs behind the stomach and goes into that splenic vein that then also goes into the portal vein. So essentially two separate systems. You got the portal system, and then the system that supplies everything else. So gonadal veins, renal veins, everything else is part of the portal system.
Okay.
So if they're marking something, a vein that's coming out of either from small intestine or colon, that's going to be either superior mesenteric or inferior mesenteric.
Okay, so
All right.
there are 2 hepatic arteries, 3 hepatic veins.
Well, now the hepatic veins, and this is kind of a where you're looking through the liver here, but you can see where they come out, and I think it's variable, but anything
Okay,
that's coming
like
out, you
branches.
won't be able to see it, so I don't think it'll be marked. But yes, those are the hepatic veins there.
Got it.
This, and don't confuse that, because this is the portal vein running into the liver. Yeah. Okay.
That
So,
makes sense.
and then okay, now when we go to the veins of the arm, you really can't see the deep veins very well, but we've identified several small veins. So key to this is you've got your subclavian vein. When it gets to the shoulder, it turns into the axillary vein. It actually stays axillary until it gets down here. And again, this is kind of diving deep, so I don't think you'll be able to see it, but you can see the axillary. Once it splits, and not before it splits, these are brachial veins. So this never becomes a brachial vein up here. Okay.
Okay.
And then there's really only 2 other veins you need to remember. This is this big vein that it comes off way up here off the subclavian artery.
It was cephalic.
Yes, that's right. Very good.
Okay.
And do you remember this one on the ulnar side?
Was that one the median cubital? Or is that
No,
one-
but we'll get to that in a minute. That's another important one.
Okay. So that one's basilic then?
Basilic, that's right.
Okay, cool.
And the easy part about this, it's cephalic all the way down.
Okay, cool.
So anything running on the thumb side is going to be cephalic, and basilic is named basilic all the way down here.
Okay.
As you were saying, the median cubital right here, those are actually kind of important veins to remember, because if anybody's going to draw blood, it's going to be
Right.
cephalic, median cubital, maybe basilic, but or start IVs, but those are the 3 ones to remember there primarily: basilic, cephalic, and the median cubital.
Okay.
All right, and then remember that this is axillary. Anything up here is axillary. Anything up here is subclavian.
Okay.
All right, and let's see. So the leg. Did we go to the arteries of the leg? I don't think we did we?
We like brushed over them, how they're like kind of similar to the arm, and we went over like femoral and stuff.
Yeah. Probably so remember common iliac, don't call that iliac, common iliac, iliac, internal iliac, or external iliac, internal iliac. Okay.
Okay.
And those are pretty obvious. The external iliac will be diving on down toward the leg, and this will disappear into the pelvis, the internal iliac.
Okay.
Okay. Then there's a femoral, and then there's, like I say, there's a deep femoral and popliteal, but that's going to be behind the knee. And you know our cadavers, how hard it is to see anything on the back of the leg. So I don't think it's going to be some gymnastics to tag that. And then, like I said, on the front of the foot, if there's something marked down here, that's going to be the dorsal artery.
Mm-hmm.
And on the back, it's going to be the posterior tibial. This is kind of confusing, but yeah, that would be this one. Let's see. It's going to be lateral. So it's going to be the on the outside or lateral, around the lateral malleolus. Yeah, I don't know that they show I can't even find a good picture of a posterior tibial, so I wouldn't worry about it. I don't think they're going to be able to find one to market either. Okay. So then veins of the leg, same thing up here. You've got common iliac vein, internal iliac vein, external iliac vein, and then you've got a femoral and a deep femoral. The other ones that are superficial that you can actually see, because this disappears, you know, deep into the leg here, but you've got the greater saphenous and lesser saphenous. So below the knee, it's the, or not, what is it? The lesser saphenous? Small saphenous.
Okay.
So the great saphenous, and it runs on the inside. Small saphenous runs on the outside here.
Okay.
All right. Yeah. And I think that's about all you're going to be able to see there that could be marked. Okay, let's see. Anything else on the vascular system? And I think that pretty much covers the list too. You know, that we had in lab that we were supposed to find.
Yeah.
So let's go over pulmonary quickly. We still don't see we've had anybody else show up. So okay, so we went through all the sinuses. What we could see in the lab the other night that you couldn't see, you know, that one cadaver with his head split open. You can actually see all of the sinuses. You can see the maxillary sinus, which we weren't able to see before on the models. So it's just a big sinus. If you remember, sitting right beside the nose. So if you see a big hole or a big cavity marked right beside the nose, that's the maxillary sinus.
Okay.
So you got frontal is going to be right up there in the frontal bone. You can see the sphenoid sinus on that same cadaver. Soft palate, hard palate. Remember the three areas of the pharynx: naso, oral, and laryngopharynx. And nobody will ask you really sharp dividing lines or anything. It should be pretty clear. If it's right behind the larynx, it's going to be laryngopharynx. If it's right behind the nose, it's going to be nasopharynx, and right behind the mouth, behind the tongue, oropharynx.
Okay, that's pretty simple.
Yeah. On the models, there's some lymphoid tissue marked back here, and those are the let's see, the adenoids. Yeah. Well, actually, down here you'll have a sublingual tonsils, and then pharyngeal tonsils way up high here.
Okay.
On these, you don't really see in these adults any palatine tonsils very well. So I doubt if those would be marked. And then got the epiglottis, of course. And the thyroid cartilage, which is pretty obvious. Okay. Trachea. And what's characteristic of the trachea? How you differentiate the trachea from the esophagus? And it's all this cartilage in there, right?
Yeah.
He's got these cartilaginous rings. So, okay, sinuses recovered. Frontal. Oh, ethmoid, you probably won't see. They're kind of little air cells right along the nose in the center. But sphenoid, remember it's going to be sitting back there by the way back, just next to the where the pituitary was, and maxillary on each side. Okay.
Okay, got it.
Thyroid cartilage, cricoid cartilage, just below it, and then these cartilaginous rings. And I think, let me see if there's a cross section here somewhere. You still seeing my screen, right?
Yes.
Okay. Oh, here it is. So here's these cross-sectional views. So you've got, and this is almost like what you see on the histology. You got the hyaline cartilage, and they make it a shape of a C. You've got the, I think they call it endothelium. Let's see. Basically mucosa. This has this cilia that make up this mucociliary elevator. Trachealis muscle. And those are the main things there. So this is the histologic section. The hyaline cartilage stands out. There's really not much anything like it. It looks kind of like glass. And this is actually not as good as the specimen that we have on our histology slide. So cartilage runs down these for through the tracheobronchial tree for 8 generations.
Okay.
So you've got the trachea, and the first thing coming off is the primary bronchus.
Right.
The next group, and there's some lungs that you can actually kind of see secondary or lobar bronchus. So where you see I kind of see that they're running into the upper or lower or superior or inferior lobes. So if somebody just handed you a lung, how would you know which side of the body it came from? Which is the way all the lungs in there are. They've all been cut out, so they're just laying in the chest, so they could just have them sitting out by themselves. How would you know which was right and which was left lung? Just looking at it.
The curvature.
Nope.
Of the.
Nope. Something real distinctive about them. You're looking at it on the slide right now. So, how many lobes does the left lung have? Two lobes. So it's got superior upper lobe and lower lobe. Let me go back here and look at here's chest x-ray. You got upper lobe, lower lobe. Or again, the book calls it superior and inferior. And the right lung has 3 lobes, upper, middle, and lower.
Okay, got it.
Okay. And so these are called like oblique fissures between the upper and lower lobes on both lungs. And then the middle lobe has the horizontal fissure that separates it from the upper lobe. Basically, the right lung, the upper lobe is just kind of cut in half. And this is showing the segmental bronchi here. Okay.
Okay, yeah, I see that.
Okay, now we get out to below the cartilaginous divisions, then it starts breaking into non-cartilaginous divisions. So you have bronchioles, you're down to 1 millimeter size airway, and then terminal bronchioles.
Okay.
And those make up pulmonary lobules. And then inside of those, you have respiratory bronchioles that come off the terminal bronchioles.
Okay.
Let's see here. Well, that didn't help. Well, I guess it did. Yeah, not really. Okay. So, so you have these lobules, and then, and so these could be, test questions. They go into the respiratory bronchioles, then the alveolar ducts, which is kind of the last branch, and you're down where it's starting to get hard to tell. There's a bronchiole, terminal bronchiole, alveolar sac, and pretty much everything starts to look like an alveola at that point almost. But alveolar sacs are just clusters of alveoli around kind of a central atrium.
Okay.
All right. And then alveoli, that's the last division, of course. So as I mentioned in class, I don't know that you need to know all of these subsegmental. We can't really mark them. and I wouldn't spend any time on them. And they're not they're not even important clinically unless you're a surgeon that's going to try to dissect the lung and remove something. Remember
Okay.
that muscles of respiration use the diaphragm and the intercostal muscles. Intercostal muscles are used more during exercise or exertion, where you're trying to move a lot of air. Otherwise, you normally breathe with your diaphragm.
Right. Okay.
And then you're gonna have to memorize these. This will be on the test somewhere. So all of these volumes. So you've got 4 volumes and 4 let's see, 4 capacities.
Capacities. Okay.
Yeah, and they're summing volumes. Okay, so just on normal respiration. So this is your total lung volume here. Okay, from top to bottom. When you're just sitting there breathing normally, you just kind of work in the middle of here, and that's right around 500 cc's.
Okay.
When you sigh, take a deep breath, that's where you use your inspiratory reserve volume.
Okay.
And then there's an expiratory reserve volume where you blow everything out. Okay, so where you try to empty your lungs as far as you can, that's expiratory reserve volume. And then let's see here. Yeah, so vital capacity is where you make that maneuver, where you have just blown everything out, and then I'm sorry, where you take as deep a breath as you can, and then you blow as much out as you can, and whatever you blow out is vital capacity. That's pretty much all the air that you can move. And then total lung capacity, you never empty your lungs completely because you keep a little in there to just keep the alveoli expanded and everything, right?
Okay.
All right. So spend a little time reviewing those, especially these volumes, tidal volume, inspiratory reserve, that's taking deep breath in, expiratory reserve, blowing everything out, residual volume, what's left.
Got it. Okay.
Okay. Yeah. Okay. So now we're into the lymphatic system, and so you know, some of these cells will be on the exam through the histology. So they're all pretty distinct, and they each have different characteristics where you can separate them. So neutrophil or PMN or granulocyte, a polymorphonucleated neutrophil, but just neutrophil is good enough. They have these kind of barbell looking nuclei. They're called polymorphonucleated because they look, each one looks different. They're all have different kind of weird looking nuclei and have all these lobes and kind of lobules hanging off of them.
Okay.
And they have these kind of light purple or bluish granules in them, granulocytes. Those are bacteria killing granules. Monocyte are pretty big cells, and they have large nuclei, and they kind of look like Pac-Man or or a bean or a kidney bean.
Okay.
And they don't have granulocytes in them. So they'll be kind of clear.
Okay.
See the difference between these two? See all those kind of speckling. Then eosinophils, they always have two lobes, but characteristic is, are they going to be red or purple granules, or pink or red granules. And they're unique in that they're the ones that are seen with primarily in allergies or parasite infections.
Okay. They're kind of similar looking to neutrophils, but they're just like
just bilobed, and the granules will be pretty red, you know. You can tell distinctly. These are always just kind of muted, maybe light pink, or there might be a few speckled blue in there. Then basophils, they're usually pretty dark. This is kind of an unusual one here. This is called a basophil. It could be confusing for an eosinophil, but any basophil we mark is going to be pretty dark blue. And one thing to remember about them, what they do is they're kind of the messengers. They call all the other cells in. They send chemical messengers out to summon other cells. And the last one we have here, so they have granules too, and they're kind of basophilic colored, or blue, dark blue or dark purple.
Okay.
And then last one is lymphocytes. And lymphocytes are they have a number of different roles. So you have T cells, B cells, which can turn into plasma cells and make antibodies, and natural killer cells, NK cells.
Right.
And so out of the T cells, you got 4 different types of them too. So you might just try to remember those. T cells, B cells, natural killer cells. And then out of the T cells, you've got cytotoxic, helper, suppressor, and memory.
Okay.
All right. So lymphatic organs. So this is showing different tonsils. So when you're looking at a tonsil, just look for these kind of collections of germinal centers. These dark and light colored places. You'll see these in lymph nodes as well. So lymphatic tissue, that's kind of characteristic of it. You'll see what are called germinal centers that are can be light in the center with dark around it, or vice versa.
Okay. And you said the palatine tonsil is the one that you don't really see in adults, right?
Yeah, they're pretty shrunken up usually.
Cool.
This is the spleen. And I think characteristic of the spleen, you've got a capsule. These pictures are not very good, but they also have this kind of splenic nodules with a white pulp in the middle, and darker colored red or dark purple cells around them. So I'd kind of take this slide deck and read up on them a little bit. There may be some questions there. The thymus, the thing that's characteristic of them is finding these thymic corpuscles. So those are collections of T cells that are just kind of surrounded or wrapped up and encapsulated after they mature.
Mhm.
And you'll see lobules in the thymus too. It's kind of a lumpy gland. You know, we haven't seen a gross specimen of a thymus. The lab looks kind of like a thyroid, but it's bigger in children.
Right.
So.
Okay.
And then a lymph node will also have these have an outer cortex. It will have these intrusions that are called trabeculae, and kind of have a white center like this. So make sure and look at what magnification you're at on this, because it can be kind of confusing if they're zoomed way in or way out. So, but yeah, there's the germinal center in them. That's actually only supposed to be seen in the midst of an infection. So we were having a hard time kind of picking out what was germinal center and what was trabeculae the other day on our histology specimen. So hopefully they may just ask what is this thing, and look for these kind of trabeculae, and that'll be a lymph node.
Okay. Sounds good.
That's what a lymph node looks like in actuality. And there's one, so you can see this is all zoomed in very close. Again, it's got a germinal center with these kind of intrusions coming down from the cortex called trabeculae.
Okay.
And here's the lymphatic vessels that we talked about. Thoracic duct is about the only thing we could hope to see.
Yeah.
But there are some little stringy vessels. I can't imagine anybody marking one, but they're going to look like just little white stringy things just in the connective tissue.
Got it.
And then you might just review these components of the body's defense: and physical barriers, phagocytosis, immunologic surveillance, interferons that are chemical messengers, basically, especially in viral infections, the complement system, inflammatory response, and fever, how the body defends itself.
Okay.
I think that's it.
Cool. Okay.
All right. Well, just you and me. So.
Well, I appreciate you going over everything with me.
Yeah. And what we're going to do tomorrow, after we have our lab, is we will actually go back and go to the cadavers and review again for the test, for the exam, and go over things, and we'll try to look at the histology a little more closely, and go over some questions. We'll go over the quiz too. Everything that we marked, we'll make sure everybody knew what those things were. Okay.
Yeah, sounds good.
Okay. Very good. Well, I'll see you tomorrow. Alexi, are you feeling better?